Hello, my name is Kate Schmidt, and I'm a student physical therapist at the University of Missouri. And today I'm just going to be talking to you about opioid use in children. So I just want to start today by talking about what opioids are and why they're used in children. So to start off, an opioid is a type of drug that can be used for pain relief or pain management, and it's used worldwide. Some common names you might recognize are hydrocodone, oxycodone, oxymorphone, morphine, codeine, fentanyl, or maybe even some brand names such as Vicodin, Oxycontin, or Percocet. So, why are these drugs used in children? Well, the most common reason that these are used in children is going to be chronic pain, whether that be due to neuropathic issues, visceral issues, nerve damage, musculoskeletal issues, or unknown reasons. Some common ones you might even hear of is surgeons prescribing this to children after some sort of surgery that might cause them moderate to severe pain, or even one of the most common ones is dentists prescribing this to children, say after a wisdom tooth removal. So, as common as these are prescribed to children, what are the guidelines to prescribing these opioids to the pediatric population? So, there really is not much knowledge to prescribing these to the pediatric population, and they mostly just pull from what they know from the adult population. The one main thing that they do recommend is that you start with a low dose and gradually titrate it so the effects are at a certain point in that child. So, why is it a problem that children are using opioids? It's a problem because this is a highly addictive substance, and just by introducing this substance to that child, you're increasing the risk for addiction and use of other substances throughout the rest of their life. You're also putting them at a high risk for health complications. In the case that opioids are misused or dosed incorrectly, children could experience CNS toxicity, seizures, difficulty breathing, respiratory depression, addiction, misuse, overdose, and even death. So now that I've talked about why children might be using opioids, I want to talk about why that is important to us as physical therapists. So this is important to us as physical therapists for probably the most obvious reason that these could be our patients and probably already are. So children experiencing neurological or muscular pain are probably also seeing us, and they're probably seeing us multiple times per week. And so that being said, we are probably the medical professional seeing them the most throughout the week and in general over time. And so it is our duty as that provider to make sure that we are not only educating those patients and their families, but making sure that they actually are safe in how they're taking their medications and monitoring them to make sure that there aren't adverse side effects happening within them. And not only could these be our patients, they could also be our future patients. So speaking about like maybe a parent who has children in the home or a parent who is currently pregnant. Women who are maybe thinking about becoming pregnant or are pregnant at the time, if they are also using opioids, they may not know, but their baby can also become dependent on those opioids and then once born can experience withdrawal symptoms at birth. So that might be important for you to tell maybe an adult patient um, to reduce those effects on maybe their children while still in the womb, or say you have a parent who's on opioids for pain management and they have children in the home. It's important to make sure that they know the effects that they can have on children so that they're making sure to lock up their medication tight so that those children can't get a hold of it. So, other than the fact that these drugs can pose a great risk um, and danger to children, why else are they a risk to children? One of the huge reasons is they're already being overprescribed to children. In a study in 2019, over 50% of prescriptions wrote to youth were already high risk prescriptions, meaning that the duration that they were prescribed for was too long and put them at risk, or that the dosage that they were taking was too high as well. So we are already putting them at risk just by getting them prescribed, because most of the time they're not being prescribed right as well. And so you could have a parent and the child thinking that they're taking this medication completely right, following all the rules, and they're still taking too much. So that's where it comes in, where we really just have to be able to monitor the kid and make sure that everything is going right for them. It also can affect their future. By taking this drug now, you're putting them at an increased risk of substance abuse disorders in the future. There was a study done where it said that opioid use before high school graduation correlates with a 33% increase in non-medical use of opioids and heroin. So another way to say that is misuse of drugs outside of the actual reason for them being used. So just by introducing them to this type of drug, you're already putting them at a risk for the rest of their life and having a dependency on this type of drug. And then lastly, as children, they obviously have differences in anatomy and physiology in their body because they're just not as mature as adults are. For example, they have an immature blood-brain barrier, which means that they can have a higher concentration of this drug in their brain. And so that's why it's so important to monitor for CNS effects, because a dose that maybe would not even have effect in an adult may have lethal effects in an adolescent. They can also develop a tolerance much more rapidly than adults can. So this means that over time, if this is someone who needs a continued prescription, they might have to have a higher dosage to continue those effects within them. But if at some point they want to stop and try something else, they're probably most likely going to experience withdrawal. So what can we as physical therapists do for these children who have been prescribed opioids? The most important thing we can do is educate them and their guardians on proper use and disposal of these drugs. We can advocate for alternative options. Maybe if you have a family speaking with you about the possibility of using opioids, you might introduce to them a couple other options before they try that out. We also definitely need to warn them about potential risks and side effects. Doctors don't always do this for them or sit them down and explain to them what types of things to look for. So it's really important for us to also sit them down and make sure that they know those things, that they can be on the lookout so that at all times they're alert while they're not in the clinic with us. And then just monitor the kid while they're with you. So maybe some common things you might look for is drowsiness, confusion, nausea, constipation, euphoria, and slowed breathing. Slowed breathing is a huge one because this can mean that they're not getting enough oxygen to their brain, and that causes all sorts of issues. I made this chart as an example of maybe a handout that we might give to a physical therapist. This way, this is something that they can easily follow to make sure that they're hitting those points when talking to that family. This could be something that so they use as like a guide. This could also be something that they use to give to the family, or maybe something that they post in their clinic, just as overall general, here's stuff to know. What you wouldn't do with this is just hand it to the family and not say anything else. That's probably what was already done at the doctor's office. We don't want to be another one that's neglecting them. If we are going to give this to them, we need to go through and explain to them what that means and how they should look for these symptoms and how they should implement this throughout their home. So I do just want to kind of talk through it a little bit. So we'll go ahead and start with the what to do's. Great things to do as a family with a child who is taking opioids. Make sure to share with your doctor if you're experiencing any unwanted side effects, withdrawal symptoms. Make sure you're disposing of your pills in the proper way. So you're using a program or possibly mixing it with an unpalatable substance such as kitty litter. So this way people aren't going to try and dig through your trash and get to those things. And then keeping the medication away from children in a safe place. Safe, locked, high place where they can't see it and they can't get to it. This way, this automatically reduces the chance of overdose by a lot. What not to do, share your medication with families, relatives, friends, strangers, anyone but yourself. That medication is prescribed to you, and you should be the only one taking that medication. Um, Take more than your dose prescribed, take for longer than you're prescribed, take someone else's prescription. So just because that you think someone else may have a similar prescription to you does not mean you should be taking it. That could be too much for you or too much for someone else. And then over here on the right, I kind of go over through some common symptoms of withdrawal. So maybe they're coming off of it and they're experiencing things. These are things that they can go get help for. So this is one of those things where it's like, hey, if you see these, come to the doctor. They can help you out. And then what are some other options? I think this is a really great one, and this should be something that we as therapists should be talking about with parents. And just explaining those other alternatives. A lot of the times they'll go to the doctors and they'll say, we want to put them on this point blank period, and then don't go into those other options. So it's important for them to know that there isn't one pathway and that they can choose. So maybe just talking about how NSAIDs, acetaminophen, or pain blocking options are also non-opioid types of drugs that you could use, or non-pharmacological modalities such as biofeedback, acupuncture, distraction type of things. Um, and then if opioids are used, you can use them in combination with non-opioid analgesics. And this would just allow you to reduce the dose of actual opioids that you're using, which will reduce the risk of all those other things by a lot. Thank you for listening in.